COVID-19. COVID-19 has really changed many lives. It has affected all globally. And for us to return to pre-COVID state, the research and science all support that vaccination is the only way forward. So today we will take the time to talk a little bit about COVID-19 vaccines, the key things that you have to know. What do you need to know about COVID-19 vaccines? This brief discussion will talk about the effectiveness and safety of the vaccines, the availability and types, the myths as well as the facts, the costs and locations, and also booster shots. And amazingly, there is constantly daily information pouring in. So there will be several websites that you can visit to find more information. So let's talk about the effectiveness and safety of the vaccine. The COVID-19 vaccines are safe and effective because it went through the same clinical process that any other vaccines have gone through. It will just roll up faster because of it being a pandemic. There has to be something to be done quickly to save lives. COVID-19 vaccines are not experimental. It went through all the required stages of a clinical trial. Extensive testing and monitoring have shown that the vaccines are safe and effective. Yes, there are side effects such as chills, tiredness, but these are normal and should go away in a few days. It typically takes about 2 weeks after you are fully vaccinated for your body to build protection or immunity against the virus. The vaccine is the only way we can resume to many activities that we did before the pandemic. So really, there is hope, but that hope means we have to take action, and that action means we have to get vaccinated. Being vaccinated against COVID-19 will help you from spreading the virus and also being affected once you contract the virus to a very extensive extent. The availability and types of the vaccine. So far in the United States, there are 3 vaccines that are approved, and those are the Pfizer-BioNTech, Moderna, and the Johnson & Johnson. All 3 vaccines are safe, effective, and reduce your risk of severe illness. The COVID-19 vaccine is just like any other vaccine. It helps your body to build immunity. That means if you ever get in contact with the virus, you won't be severely affected as compared to somebody who has not got any vaccine. So the 3 vaccines, the Pfizer is recommended for people 12 years and older. It is 2 shots that you could get 3 weeks apart. And then 2 weeks after the second shot is when you are considered as fully vaccinated. The Moderna is recommended for people 18 years and older. 2 shots are given 4 weeks apart. 2 weeks after your second shot is when you really know that you have immunity or you've been fully vaccinated. The Johnson & Johnson is recommended for people 18 years and older, and that is 1 shot. And 2 weeks after your shot, you are fully vaccinated. It's actually by choice and by availability, but all 3 vaccines are safe and they all serve the same purpose to help your body build immunity against the coronavirus. Now let's talk about some myths. There are several myths. We cannot discuss all, but the few that we will discuss are whether the vaccination is what is causing the virulence of the virus. and that is false. The new variants of the virus happen because the virus that causes COVID-19 is constantly changing through a natural ongoing process known as mutation. And because it's constantly changing, there has to be several research all the time, and there have to be several ways in order to fight this virus. So the COVID-19 vaccine can help prevent the new variant from emerging. If we all get vaccinated, that means the virus will not be able to mutate. We will be able to prevent the spread of it. The second one is if the COVID-19 vaccine has microchips, and that is no. COVID-19 vaccines, like I mentioned earlier, are just any other vaccines. It's just like the flu vaccines. It's just like any immunization that you've got. The vaccines are developed to fight against disease and are not administered to track your movement. It's just like the flu vaccine or any other vaccination that you've ever got. When you receive the COVID-19, will it make you magnetic? And that is false. It's a no. The COVID-19 vaccine is just like getting a vaccine. You get it injected, and that's it. It's a medication in your arm, usually as you get vaccinated. The last one is whether the COVID-19 vaccine will change or interact with your DNA in any way, and that is a no. The RNA, mRNA, which was used in developing the vaccine, is delivered instruction to our cells to start building protection against the virus. It doesn't change our DNA. You will be who you are. Getting the COVID-19 vaccine is just like getting a flu vaccine or any other vaccination. There is no special elements in the COVID-19 vaccine. The COVID-19 vaccine is designed to help our body fight the COVID-19 virus that has caused the pandemic and has really changed our lives in so many ways. Now let's talk about the facts. The facts about the vaccine. Getting the vaccine means that it's possible that you could still get COVID-19 either before or just after vaccination, and then get sick because the vaccine haven't got enough time to help your body build protection. It takes time for your body to build protection. And until then, you could still get sick. People can sometimes get COVID-19 even after being fully vaccinated and their body still having immunity. However, this only happens in a small portion of people, even with the variant, which is known as the Delta variant, and it's been discussed extensively. When these infections occur among people that are vaccinated, they tend to be mild. COVID-19 vaccine also help keep you from getting seriously ill, even if you get the COVID-19, and that is the goal. It will be mild in a way that you can be treated and you can be well. So getting the COVID-19 vaccine doesn't rule out the fact that you will never get COVID-19. You will get it, but you will be able to recover because it will be mild and you could get treatment for it, compared to somebody who has not get the vaccination, who might end up losing their lives. And the virus has claimed so many lives. It does not discriminate. And that is the need for this health fair, for us to talk about how to protect ourselves and how to fight against the virus. Now let's talk about the cost and location. The COVID-19 vaccines are available for everyone at no cost. Nobody should pay to get a COVID-19 vaccine. It is approved by the US government to be given to everybody, regardless of their insurance or their immigration status. There are so many locations that you can go to get vaccinated. You can either go to vaccines.gov to find out more information. You could text your zip code, and the number is 438-829 or 1-800-232-0233. And that will tell you where in your area you could go to get vaccinated. Local pharmacies are offering vaccination. Walgreens, CVS, all the major pharmacies, as well as small local pharmacies, are all offering. And also News 12, Fox 5, all the other news channels give daily updates sometimes of where you can find vaccinations. So when you want to get vaccinated, there is no restriction. You could get it anywhere. No insurance is needed. Nobody will ask you about your immigration status. You just walk in and you will get vaccinated at no cost. So at this point, you can go online to book it. You could text to find the location. You could walk into a pharmacy and you could end up rolling your sleeve just like everybody else. Let's all join in to fight against this virus. As time goes on, the research showed that there are a certain group of people that will need additional shots after 6 months of completing their initial vaccine series. And the people are 65 years and older, people age 18 and older who live in long-term care settings, people 18 years or older who have underlying medical conditions, age 18 or older who work in high-risk settings, and people 18 or older who live in high-risk settings. If you fall in any of these categories and you receive your initial vaccine series within 6 months period, you could go to get additional dose. Now, why are we talking about additional dose? This is because we want everybody to build immunity against this virus. So if you fall in any of this category, please go and get your additional shots in order for your body to be able to fight against the virus. Getting additional shots is the same as getting the initial shot. Still no cost, and still you could get it anywhere. You just have to take your card that was received initially to these places and they will update it. These are extra places to find more information. In case I didn't cover anything here, you can go to cdc.gov to find more information on vaccines. The City of Elizabeth has a Facebook wellness page, and you can find more information there too. So let's all join in, enroll in our sleeves, get vaccinated, and let's fight against the COVID-19 and save as much lives as we can. Thank you.